Welcome in, everybody. Thanks for being here. We are going to be going over a technique that I call bowing the spine. This is a hard opening or back bending technique. And we're going to be going over the biomechanics of how this works, why it works, how it's going to help you feel better in your back bends. Okay, so I will be monitoring the comments here as well, but I do want to stay focused and stay on track. You can put your questions in the question box. That's the easiest way, and then I can pull up the Q&A over here. So once you put a question in there, I'll be able to see it and answer those later. So let's get started. What is bowing the spine? Well, first of all, the term I just came up with because it is present in many back bends, this word bow. We have bow pose, Dhanurasana. We have upward facing bow, Urdhva Dhanurasana, which is full wheel. Some people call that bridge in like gymnastics or whatever. You have Chapasana, otherwise known as sugarcane pose, which is a Chapasana, from what I understand, is a type of wood that the bow was made out of. So Chapasana is basically like Ardhachandrasana, like half moon pose on its side, but grabbing the foot. It's another variation of bow pose. Dancer pose is very similar to bow and Chapasana. There's a numerous amount of yoga poses that share a commonality in them, and that is this idea of bowing or back bending or arching or extension, spinal extension. And a lot of people have a discomfort in back bends, and that's what I want to get down to, a way to get out of discomfort. Before we totally dive into what is bowing and the spinal curves, and we're going to take a look at Mr. Bones over here and how to apply this technique, I do want to make a couple of announcements. First, there is a back bend immersion that starts in May 4th. And this is entirely based on hard opening or discovering the joy of backbending for yourself. So what I share with you here is going to be implemented throughout 12 yoga classes throughout the month of May 2021. It'll be available live, so you can live stream and practice with me, where we will be actually practicing real time. But if you can't make the live sessions, which happen on Tuesday, Thursdays, and Saturdays at 12 p.m. Eastern Standard Time, that's New York City, same time zone, then you get the classes for life anyway, so you can practice on your own time. And now's the best time to sign up because you get the pre-registration price. So you're saving about $50 if you sign up now. So the link for that is in my bio. Just click on it, it'll take you to theyogimat.com, or you can just go straight to the May immersion, which is again called hard opening. So that's one announcement, May 4th. Starting May 8th is the 300-hour online teacher training, which is very exciting for those of you that are already certified yoga teachers, want to take your certifications to the next level, learn biomechanics, techniques, how to apply that into sequencing and transferring that to your students' bodies and how they can integrate it, as well as learning yoga philosophy, how to weave a theme, a message through to your yoga class, business structure, social media, marketing, all the things that go into becoming not only an excellent yoga teacher, but also getting your teaching out there to others. That is what this 300-hour training is all about. Yes, you will get certified with Yoga Alliance 500-hour RYT if you complete before the end of this year, according to Yoga Alliance at this time. If you complete by 2022, then January 2022, then you will be certified with Yoga Alliance, 500-hour level, which gives you certifications and so on. You might be able to then train teachers in the future and such. But aside from the certification, the qualifications that you get, the increased level of teaching, taking your teaching to a whole nother level, being able to produce an experience for your students where they learn on a deeper level, they have those aha, revelatory moments both in their body and in their mind. That's what the 300 hours is all about. Last thing I'll announce, and then we'll get right into this, I promise, is the 200-hour training. Those of you who are not teachers will begin at the end of May. So if you're interested in that or the 300-hour training, just reach out to me directly. The links are in my Instagram profile. So if you go to the Yogi Mat Instagram profile, those of you that are on YouTube right now watching this, go to my Instagram at the Yogi Mat, same as my YouTube, and you'll find it there. Q&A is down below, so please feel free to use it. I do want to decline this call that's coming in. It's going to interrupt. Okay, and let's get started into bowing the spine. First of all, what is a back bend or what is hard opening? According to anatomy terms, it's spinal extension. And in order to do spinal extension properly, you have to directionally move your body, and it matters. What matters most is understanding your relationship to gravity. So what I mean by that, let's just get into the spinal curves and then we'll go back into that gravitational definition. So we have the 5 spinal curves, more traditionally known as the 3 spinal curves, more modern day 5. Okay, let's go over the 5. Well, you have the skull, which is, we all know, the top of the head here. Show you on Mr. Bones here. It's got a skull that is convex, it pushes out. And then the cervical spine is concave, it moves inward. Okay, so if we're orienting ourselves to this, cervical spine goes this way. Again, then we have the thoracic spine, just like the skull, it goes back outward. That's where your rib cage is. It's less mobile because it has all these ribs attached here to the spine, making it still mobile, but less mobile than perhaps the lumbar spine, which is concave, just like the neck. So let's see if I can arrange my hands here. The neck and the lumbar share a backbend-like curve, okay? Whereas the thoracic, skull, and the sacral tailbone area here share a convex, I hope I said that right, convex, outward-like bulge, right? So you have concave going inward with the cervical and the lumbar, and convex with the skull, thorax, and tailbone, okay? Now, the lumbar tends to be very mobile, and you'll see that a lot of people here, we have these things between the vertebra. So I'm going to come a little bit closer. Hopefully this will show up here. So Mr. Bones here from the side. These bones here are vertebra, okay? Bones, they're just bones of the spine. But in between them, hopefully you can see that, is this squishy-like stuff. Okay, can you see? It's a little bright. I apologize. So maybe if I shield the light a little bit. Okay, between the bones, there's a squishy stuff called intervertebral discs. So here, this little squishy, clear, coaty thing, intervertebral discs. Okay, why do I keep missing? There it is here. Okay, those intervertebral discs are what we want to protect, but they're also protecting your nerves. If your spine just sat on top of each other, then all these little nerves would if your bones of your spine sat on top, number one, we wouldn't have that much movement, maybe just minimal, but we would be pinching all the nerves. And that happens when you have a degenerative disc. The disc starts to deteriorate, then your bones collapse on each other and pinch the nerves, and that's also painful. But also the discs, you can see this classic little bulging disc here, is when the disc kind of leaks fluid out the side, the front, or the back, whatever, it will tend to press on the nerve. So that little bulge pushes on a nerve and you get back pain or discomfort, okay? So the primary thing about what people think is like, don't do back bends if you've got pain. But more often than not, if you've got pain from a pinched disc here, it's don't do forward folds because the nerve is actually behind. So if you slid that bulge back, that's when it would hurt the nerve. If you slide the bulge forward, you wouldn't really feel that, okay? It's not saying that you, should have a bulging disc. We don't want those at all. But hopefully when you start to see that you've got all these bones stacked on top of one another and then cushiony discs between it, we want to take care of the discs. And part of doing so is understanding that the discs themselves can slide in between the vertebrae. They have sliding motion. And this is what the bowing technique that I call it bowing technique is all about. And I want to share that with you today, is how to slide your intervertebral discs appropriately to allow for optimal opening of the heart, or back bending, however you want to look at it. First of all, back bending implies that you bend your back, and actually it's more of like a forward bend. That's kind of confusing because you think of a forward fold, but we're actually moving each disc forward. So we move the whole spine this way in order to open it like a clamshell this way. And that's really the essence of the bowing technique, is pressing wherever the center, and this matters with what the shape is, okay? So sometimes the center will be the center of your spine. Sometimes it'll be a little bit lower, like the center of your belly. Sometimes it'll be like more your heart, which is, let's say it was camel pose. The center of the pose is going to be more here. Whereas dancer pose, the center of the pose is going to be more here, okay, because they have more in the pelvis. I'm not going to get too deep into the details of that today, necessarily of where you have to put the opening, but what you really want to learn first is this understanding. You see this bowing over here. So I've got this, bow and arrow kind of thing. It's just an arc, okay? You can imagine that's your spine, this arc-like shape. If you push the center of the bow forward, so I have these arrows going this way, push the center of the bow forward in order to slide your intervertebral discs forward. Now, they're out of the way, which is going to allow you to articulate your vertebra into what would be called, I guess, posterior tilt, but each vertebra is going to start to lift up in the front and down in the back. Now, what most people do is they don't lift up in the vertebra in the front, but they just collapse the vertebra down the back. Oh, it already hurts. So if I just back bend, then I usually will sit each vertebra on top of each other. And that feels uncomfortable because the back of my spine is just pushing into itself. So each one of those bones are collapsing inward. Versus if I treat them like a wheel that they can move forward and go up like this. Okay, so that forward direction, upward on this end, downward on this end. So you see there's two arrows. So whatever's below goes down, whatever's above goes up. So the rib cage goes upward, the pelvis goes downward. They pull in two different directions and you get this real nice elasticity about the spine. Now this is very hard to explain without you like actually getting into your body, and you can just caution with gentle, if you have any back issues, don't do this, okay? So what you should not do is standing here, tuck your tailbone and like start to move your body back like this. And you'll feel that the weight of gravity pushes you downward in the back of your spine. You'll probably feel a collapsing right at the lumbar, at the low back. Unless you move your pelvis forward, which will give you a little more space, but then you'll collapse it a little bit more at the lumbar, a little bit lower between the pelvis and the low back, until you move the midsection forward. Okay, so what you can't see is that my hips and my thighs are sliding way past my toes. So to do a standing back bend like the one I'm just showing you right now, you have to have a lot of ankle mobility in order to lean that far forward. Or you would have to bend your knees. Or you might have to lift your heels up. Okay, so what you can't see is my ankle joint. I'm not going to move the camera for that sake, but you can just say when my hips go forward, that requires a deep, what's called dorsiflexion in the ankle, a deep bend of the ankle. So let me just get into a couple of things. With bow pose dhanurasana, when you're on your belly, keeping your low back pressing towards the ground while you press the low rib cage forward, heart up, okay, and then kicking the underside of the pelvis, the thighs and the legs back. Being able to do that in bow pose is very hard because you're on the ground. The pose itself might be accessible because you don't have to balance, but it is very challenging because you are on the ground and it's hard to press into the earth, but it feels great once you learn how to do that, to move and slide the rib cage forward into that bowing action. Urdhva Dhanurasana, upward bow, is even harder because you're working against gravity to expand, right? Because gravity pulls you down and automatically that's going to put you into that compressive state until each one of your bones of your back are able to push the discs, the intervertebral disc, forward so that again you can open each one of the front of your spine like a clamshell opening up. A lot of people focus on the back of the spine going down, and if you think of that mentally, if the back of your spine going down, that's what's going to cause the pain. But if you think about the rib cage going forward, the spine going forward, the stiffest part of your back, you can typically feel that out. We want it to move forward. Then lift the front part of it. The front part of it goes upward typically, whereas the legs and everything go down and backward. So think about the spine really going forward and upward. Your pelvis even could go backward. There is some tucking tailbone and techniques that can work here and there, but more often than not, well, it's not more often than not, it really depends. And I don't want to get too much into the pelvic tilts and everything, but really focus on the spine right now. Forward and up, think of that as really going to help you out. So that's really the top part of the bow. That's good enough for now. Let's get into, I just want to show you on Mr. Bones over here what that bowing technique is like. Okay, so if Mr. Bones just does the classic back bend where they put the pressure down the back like this would hurt a lot. You can even see it in him, it's uncomfortable. But instead, I'm going to show you if we move this, I mean, he's not supposed to really move. He's made up with wires and he's not really a mobile thing. And there's a rod down his back. But if we can press Mr. Bones, bring that closer. Yeah, even that's pretty good for a stiff statue. Check it out. So I'm bending him by pressing his back here forward. And then if I could, I would lift his chest up. He's doing a pretty good job. But the lower side here is going down. The upper side is going up. And that's a pretty nice back bend for an immobile statue, I have to say. Here he is here. But I'm putting the pressure in his spine to go forward and then up. Wow, that's pretty good, Mr. Bones, I have to say. And then what happens is these discs, they're not going to do it here on this artificial skeleton, would push forward, and then you would open up each vertebra in the front, creating space for those discs to move forward, which ultimately is going to give you a feeling of certainly stretching the front body and opening. Why I think heart opening is probably a better term, because it's more accurate to the biomechanics. I mean, heart, maybe not heart opening, but front body opening would be a really nice, accurate, in my opinion, for biomechanics of what needs to happen, versus back bending feels like you're just kind of like bending your spine downward or backward. I don't recommend it. Okay, so this is, again, this is bowing technique. I do hope that it's been useful so far. I am going to take some questions right now. Okay, so if mid back is stiff, okay, so this gets a little bit confusing because you don't want to over mobilize your upper back. Like you want it to be in a convex shape. Like you want it to be rounded. You don't want to overly put the pressure there, but in certain poses, you definitely have to mobilize it if you're going to be in a pain-free back bend. You can't, there's no way around it. But of course, there's hips and shoulders that have to be mobile as well. I'm not getting too into that. You know, that's part of the back bending techniques that you need to learn, is how to appropriately open the shoulders for the specific back bend. Like each of these are significantly different in shoulder opening that are required, okay? And then hip opening is pretty much the same for these two, a little different for this one over here. So you do have to think about that. But the front body, if it's tight, as I think the question is really, the front body, the abdominal muscles, we have these, let's say the superficial abdominals of the obliques, the outer obliques, and the rectus abdominals, and even the internal obliques will all hold this rib cage down towards the pelvis. So with that, if you try to do a back bend, if the front body is shortened and it's not letting go, and then you try to shorten the back body, it will feel just like compression. So there has to be, yes, an elasticity about the abdominal. You see how I'm not down here and doing a back bend like this. There's an expansion and a lengthening of the abdominals that needs to happen. Now that flexibility of your abdominals should be done slowly over the course of time. The bowing technique can be applied, but you can only go as deep as your abdominals will allow you to. If your abdominals are super tense and tight, of course you don't want to do something that would tear them and cause injury. So that would be like stretching them too fast, too hard. That happens for a lot of people when they think of, they recognize, I'm tight here. And they, like the hamstrings, just like, go stretch those things. And then you get pain in the back of your butt. This happens with yogis. Yes, flexibility, I think, is a really good thing, but also a very dangerous thing, something that should be approached with care and the utmost amount of attention and focus on sensations of your body. And ultimately, it should be something that happens over the course of time. So that's something that's required is patience, right? Patience is tough, but also it's not just practice and patience and practice. It's dedicated, focused, attentive, and intentional practice. So really focusing on the actions. So lengthening the spine by moving it forward, that bowing, you see the directionality forward and up, 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 and lengthening the abdominals over time. And eventually these back bends will start to feel good when the abdominal cavity is softer or more willing to be elastic, but we want it to be able to come back together as well. So we're not just trying to, stretch it apart and that's it. That's why the arm balance practice is really important to develop strength of the front body, but we want to complement that with back body strength, especially since most of us are, in this seated position most of our day, shortening the abdomen. These muscles tend to be tight and closed off. The other thing I want to mention is the intercostal muscles, the muscles between each of the ribs. Mr. Bones here doesn't have those, but there's muscles between each of these ribs that compact the chest if they're tight and limit our ability to breathe up here. And if that's the case, then backbending is going to be very difficult because you have to be able to breathe here, okay? If you're breathing down here, which is called belly breathing, the diaphragm moves down, the belly pushes out on the inhale, exhale, it goes back. That's great for normal everyday breathing and for relaxing. It's not great for back bends because what happens is when your diaphragm goes down and out, some back bends that's okay, like the preparation of softening into a cobra pose. It's okay if you're breathing into your belly, but if you're going to then go the next step of trying to create the elasticity in the spine and that lengthening, then you're gonna wanna draw the belly in and up because it's like, how do I explain this? Well, if you have muscles attached at the ribs and the pubic bone, right? If you push those muscles outward, then they're already tight and they're not gonna allow you to move this way. But if you bring those muscles inward, then the distance between here and here is now shorter. Because it's not going out this way, right? It's now as short as it possibly can be. It's just relaxed state this way, the muscular system now. Not talking about the diaphragm, which is a muscle, but we're talking about now when the diaphragm is upward or outward and the breath is moving up here, then the abdominal muscles can lengthen maximally. So what you need to learn how to do for that, and I don't recommend this like say outside of the yoga practice, like you don't want to be walking around all day like this, it's not going to be healthy for you, but it's great for twists and back bends to learn how to draw the abdomen in and up and still breathe up here in the thoracic cavity. So what's required there is the intercostal muscles be flexible enough for the diaphragm to push the ribs out and back in, out and back in. So this, again, it takes time and repetition. If you want to get the bowing technique, you're going to have to slowly build flexibility in the core. You have to slowly build flexibility in the intercostal muscles. It takes time and, of course, practice. So if you want to practice these things with me throughout the month of May 2021, we will be practicing 12 yoga classes. That's 3 classes per week, live streamed. If you want to attend the live, you can. It's 12 o'clock noon every week, Tuesdays, Thursdays, and Saturdays. And we'll be practicing back bending, all on the bowing of the spine, learning how to integrate this biomechanic technique throughout different postures. We're going to be going over things like full wheel bow pose, Japasana, but we're also going to be going more advanced postures broken down in a step-by-step technique so that everybody has access to them. You're not necessarily going to be like doing, say, scorpion pose and having your feet touch the head right away and balancing in the middle of the room. I'm not making silly promises like that. I'm going to give you the development, the techniques to develop your practice and your body awareness in order to take, let's say, king pigeon with a strap so that you understand how to move your shoulder properly, how to activate the hips properly, how to articulate this bowing action in the spine within a posture like that when one leg is forward in a hip opener and one leg is back. How do you activate these muscles appropriately? So some of you will use the strap, some of you won't use the strap, so props will be provided, or not provided, but instructed. Let's put it this way, I'm not sending everybody props. But if you have props, I'm gonna show you how to use them so that wherever you are in your practice, it's gonna give you an approachable posture throughout. So we're gonna do things like King Pigeon, King Cobra, King Dancer. Again, we will be doing Scorpion, of course, in a safer way than not in the middle of the room expecting you to balance or anything like that. That's not gonna be the focus. We'll be doing the more traditional postures like these over here. So that's Tuesdays, Thursdays, Saturdays, 12 o'clock. We begin May 4th. That's next. If you're watching this live, then that is going to be next Tuesday. Okay, so I hope to have you in that. The link is in my Instagram bio. You could also just go to theyogimat.com and click the live tab, and it'll take you right there. If you're watching this much later, then click that live tab and you're gonna see whatever the current live immersion is. And then if you scroll down, or you can see this one, which is the May 2021, immersion. So this is what we'll be focusing on. Also, if you're interested in the 300-hour training or the 200-hour training, again, links are in my profile, but for those trainings, it's best to reach out to me and let's have a discussion about whether they're right or kind of in alignment with what you're looking for. So just check the live chat real quick. It's easier for my phone here. I'll just check. What is the cause for stiff upper back, not open in the front body, actually problems with the spine itself? Well, if you've got actual spinal issues, I mean, I'm not like a spinal doctor or anything like this. I'm not going to be prescribing anything specifically or telling you exactly what you should do. First of all, you should see somebody about whatever the spinal, if you've got a bulging disc or degenerative disc or something like this, or, one of the nerves is being pinched, or whatever, the handful of injuries that could be happening, that's something you should definitely see a professional about and seek, a training regimen from them. This is something that I used to do. So when I was teaching private yoga in Manhattan, I worked with many clients who had spinal injuries. And though I'm well trained in anatomy and everything, of course I don't have the same knowledge that say a chiropractor or someone who has actually worked on the studied the spine their whole life. And so I would require my students who were practicing with me to see both a specific chiropractor, someone that I trusted, a chiropractor and a physical therapist at the same time. And of course, make sure it was approved by their physician or their doctor. And we would work as a team of 3, all in discussion with one another, making sure that we were all on the same page, or if one of us found something, that we let someone else know if there was a pattern that maybe, muscular pattern or whatever. And this is a great way of working about it. I don't suggest just doing yoga for your spine, for your back health. I don't suggest just going to the chiropractor or just doing, cupping or just doing acupuncture. Now, all these things are great, but they're all methodologies that are limited. Yoga is limited, chiropractic is limited, physical therapy is limited, cupping is limited, the needles, acupuncture is limited. They're all limited. Utilizing the tools from each of them, that's what's going to promote health, because ultimately they're all going to build your body awareness, and attention into that area is what's going to really promote health. Now, some injuries, of course, are irreversible. And those you really, that's where you have to see somebody. Maybe it is appropriate to get surgery on a certain area. Of course, get multiple opinions, because a surgeon is trying to sell you on surgery, and that's the deal. So cross platforms, that's my suggestion if you do have actual injuries in your spine. But if you're just having discomfort or just kind of ordinary pain in back bends that just doesn't feel good, that kind of thing, then this bowing technique is a great methodology. So I'm just going to check here. Sorry, my phone just rings and I missed part of your conversation. Would you please put like a post on how and when we can meet? you for your classes, please. Yeah, so I'll say it again. So for the month of May, we'll be there May. Oh, cool, thank you. Those of you that are saying that you've already signed up for the month of May, that's exciting. For the month of May, Tuesdays, Thursdays, and Saturdays, we're going to be practicing live at 12 p.m. Eastern time of the US. So that's New York City time, 12 p.m. lunchtime. And, you know, in I think the UK, it's like 5 p.m. I think in, say, Germany and Austria, that's 6 p.m. Or 1800. So, you know, check your local time. But if you can't make it, don't worry. You can practice at any time. You get lifetime access. The link is in my bio of my Instagram. So after this, head right to my Instagram bio, click the link, click on Heart Openers for the month of May 2021, and that will take you right there and you can sign up. And also, if you are interested in the 200 or the 300-hour training, send me a message. If there's no more questions, then we're gonna keep going first, but let me just check how many hours per session. So for the backbending immersion, or what I like to say heart opening immersion, each session is 1 hour and 15 minutes, okay? So we work from 12 o'clock to 1:15. And so if you can't make the live stream, you practice whenever it is convenient to you. But we do full practices, so it's not just like a little 20-minute like warm up, you know, before work just to feel like you did something for the day. This is really about transforming the way you move, the way you are existing in your body, the way that you understand your bones, your muscles, your joints. So the whole point of this is to really help you expand into your potential for your body. So 1 hour and 15 to me is a great time frame for that. So that's for those classes. Let me see what else is coming up here. Yes, you're very welcome. Happy to answer. Just to recap what we went over, moving each one of your vertebra forward, which also takes the pressure off from gravitational pull, especially standing, but in every direction. If you seek out the stiff vertebra, the ones that aren't really moving in your back bends, and push them forward. Find, you know, I can kind of articulate which area of my back I'm pushing forward, and you can too. So you have all these muscles along the back side of your spine that can articulate and help you, but also you can lean and shift your body weight appropriately to find where those stiff points are in your back and where it feels best to push, push, push to expand the front body. And remember, that's opening like a clamshell, so the upper body lifts up, 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 and also the lower body. So if this goes up, then pubic bone and pelvis goes down. So you expand and lengthen, create elasticity. Okay, so that's the bowing technique, and I'm going to help you implement that and make it more clear in our physical bodies throughout the month of May. So I'm very excited for those of you that are signing up and ready to practice with me. Well, again, you'll get 12 yoga classes throughout the month of May, hour and 15-minute classes, and this is the heart opening immersion. We begin May 4th, so make sure you sign up today. You get a discounted rate for signing up before the immersion, so head on over to the profile, click the link, and get signed up. I'm very excited to be sharing this with you. This is going to be a blast. We're going to have a lot of fun. And also 200 and 300 hour trainings. The 300 hour starts May 8th, so if you want to get certified at the 500 hour level, then the 300 hour level plus your 200 makes a 500-hour certification. So send me a message and we'll talk. Thank you everybody for tuning in live. Those of you who are going to watch this on IGTV or on YouTube later or Twitter, wherever you are, thank you for tuning in. I appreciate sharing with you, and I appreciate your ears and your eyes, and look forward to sharing more with you soon. I'll see you on the next one. Take care. Bye-bye.